So we're presenting two posters here at the scientific sessions this year. We did a patient survey in our clinic at St. Mark's Hospital in Salt Lake City and our diabetes center. It was a 16-question survey focusing mostly on how continuous glucose monitoring was either helping or not helping people with respect to fear of hypoglycemia, frequency of severe hypoglycemia, test strip use. We looked into some of the cost savings potentially with continuous glucose monitoring. So what we found with our first poster abstract is that patients decreased their test strip use by 50%. Test strip use went from 6.4 a day down to 3.2 tests per day, which obviously has implications potentially for big cost savings. The number of severe hypoglycemic events that required emergency medical treatment was reduced by 86%. So there were 28 episodes in patients in the year prior to using CGM and 4 in the year that they started to wear the Dexcom G4 system. So pretty major reductions in severe hypoglycemia, which obviously has a lot of important implications, and then big reduction in test strip use. Our second poster was looking more at quality of life and patients' fear of hypoglycemia. So we asked patients in the year prior to and the year after starting to use the Dexcom G4, how much they worried about hypoglycemia. So choices were most of the time, frequently, occasionally, rarely, or never. And what we saw was 45 patients in the year prior to wearing the CGM said they worried about hypoglycemia most of the time or frequently, and that was reduced to 1. So 45 patients down to 1 after they were on the Dexcom G4 system for a year. Almost completely eliminated significant worry about hypoglycemia with frequent CGM use.